everyone, I'm Dr. Cindy and I want you to go floss yourself. So I'm doing fun and educational videos about dentistry. I've been practicing dentistry here in Canada since 2012, and as the owner of my very own practice, Horizon Dental, I love finding new ways to brighten lives and create smiles. So make sure to subscribe to my channel and click the notification bell so that you can see my videos every single week. Just a quick disclaimer, please remember that this video is for fun and educational purposes only. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment. So if you have any dental concerns, please consult your oral health care provider. So raise your hand if you've ever experienced any of the following symptoms: jaw clicking, headaches, especially on waking up in the morning, referred facial pain, pain with chewing, pain with yawning, tinnitus or ringing in the ear, and maybe difficulty opening and closing your jaw. Yeah, me too. And it's always worse when I'm under a lot of stress. So in this week's video, I wanted to cover TMJ, or temporomandibular joint dysfunction, including 9 tips for TMJ self-care that you can do at home. So just for background, for those of you that aren't familiar with the anatomy, in the simplest terms, pain from your TMJ can either come from the joint itself, the bone, or the muscles that move the jaw up and down. Dysfunction related to the bones in the joint is a lot harder to treat than muscular pain. It's more often related to things like arthritis, trauma, or congenital disorders that will actually degrade the bone and the joint over time. Sometimes people actually need surgery to correct these dysfunctions, but the most common form of TMJ dysfunction is very treatable, and it's referred to as anterior disc displacement with reduction, which are fancy words meaning that we have a small disc in the TMJ joint, and it allows the joint to move smoothly up and down without the bones grinding on each other and causing pain. What happens sometimes is if there's inflammation of the joint or some sort of muscular imbalance or trauma or even overuse from, say, grinding or clenching, what'll happen is that that disc and those ligaments will become stretched over time. And that means that when you go to open your jaw, you sometimes will have that little disc slip forward ahead of the bone and will get stretched out. And that's where that clicking or popping sensation comes from, because when you start to open your jaw all the way, like so, you will feel that little disc pop back into place. So this displacement isn't always painful. Sometimes it's just noisy. But if that little disc doesn't pop backward into place and it gets stuck, then that's blah. But if that little disc gets stuck and doesn't pop back into its normal place or doesn't reduce, you end up with what we call an anterior displacement without reduction, and that might actually limit the opening and function of your jaw. So what can we do? There's no real surgical options that are going to relieve this kind of pain or dysfunction. As a dentist, I can make my patients a custom supportive appliance, a bruxism guard, or you might refer to it as a night guard. This will protect the teeth from grinding, but also promotes relaxation of the muscles at night, so that hopefully you're going to break that neurological cycle that's contributing to the grinding activity. Other people, like myself, also find relief by getting Botox injections, usually into the masseter, so the long muscle along the jaw. And what's going to happen over time, and usually after repeated treatments, is it's going to reduce the force that you can put onto your jaw joint. And it will eventually kind of weaken the muscle over time so that you cannot be as hard on your teeth as you were before. And that will often reduce muscle pain from grinding and clenching. But overall, the best way to address your TMJ pain, your concerns, are actually things you can do at home. So, as promised, here's 9 tips for TMJ self-care. Number 1, When your jaw is clicking or you're feeling pain, make sure that you rest your jaw and avoid chewy or really hard foods. Usually that inflammation will reduce on its own over a period of 10 to 14 days. 2. Monitor and correct your posture. Make sure that you keep your back and your neck moving throughout the day. Remind your head to stay over top of your center of gravity, over your spine, shoulders back. And if you tend to sit at a desk all day, make sure that you have adequate lumbar support, that your core is engaged, and that both feet are on the floor. Also, take frequent breaks from sitting down. Number 3, remember that everything in our bodies are fully connected together. So strengthening and stretching out your back and neck muscles, as well as your hips, will actually make a huge difference in any of your TMJ pain. Sometimes it's really helpful to engage a physiotherapist to kind of evaluate your weak points and give you guided exercises that are going to be targeted specifically for you. But there's a lot of resources and videos out there. The main muscles that we want to target are your lower rhomboids and latissimus dorsi, making sure that you're doing scapular retraction. And there is a wonderful physiotherapist on YouTube, Dr. Jo. I will put a link to her YouTube page down in the description. She has some excellent exercises for working on your neck and back. Number 4, break that daytime jaw clenching habit. A lot of us, especially when we're stressed or in certain situations, will clench our teeth together. It's really important to be mindful of these habits and work on breaking them. Ways to do that include pretending that you're gargling or swishing mouthwash, like clicking your tongue. You can put the tongue to the roof of your mouth and draw circles. This may tickle. And try to repeat this 10 to 12 times a day. This is definitely more effective when it's done during the day, especially during activities where you might be more likely to clench, like when you're sitting in front of the TV or even driving on your way home from work. Number 5, improve your sleep posture. You need to have a proper pillow with neck support, and it's not recommended, despite my best efforts, to sleep on your stomach because, of course, most of the time when you do that, your head is turned to one side and you're putting pressure on the neck itself. Tip number 6, massage and stretch your jaw muscles. And again, this is a really great opportunity to speak to an RMT and get some guidance about some things you can do at home, or have them conduct some manual therapy exercises on you as well. It's recommended to stretch the jaw twice a day. And there's actually several different exercises that I am going to demonstrate here. So first off, the simplest one is thumb resistance. So taking your thumb, placing it under your chin in that nice little triangular area, and just opening and closing the jaw with a little bit of resistance like so. Number 2, temporalis massage. Temporalis is the fan-shaped muscle that comes up here. So what you want to do, use your fingertips, light pressure, and actually find where the muscle is engaging when you clench your teeth together. So, fingers on your temples, bite down. There it is. And just gentle circles back and forth. It helps to run your fingers along the long muscle fibers as well, and just really gentle. You don't have to have a lot of pressure. Just got to find those muscles and just slowly work the knots. One of my favorites is a simple masseter massage. So the masseter is this long muscle, this big muscle that goes through here. This is the one that I get my Botox treatments on. And again, what you can do is use your fingertips and bite down. You'll feel that muscle engage, and same kind of thing. Little circles, move around, and massage gently along the long axis, along the muscle fibers. Up and down, little circles. Find the spot, engage, and keep that up for a good 10 to 30 seconds. One of my other favorites is also for the masseter. This is where I find the majority of my TMJ pain comes from. For this one, placing the knuckles gently under your cheekbone, under the zygomatic arch. Right now, I can even feel the trigger points engaging. And again, gentle pressure. You don't have to go hard on these. And then just gently open and close your mouth, like so. Find the right spot, find that trigger point. I need to be doing these more often. Last but not least, if you're very tense, very tight, apply heat to the muscles so that they can relax. Tip number 7 is to consider changing the way that you yawn. If you have a history of locked jaw or where that disc gets stuck forward here and doesn't allow you to fully open or close your mouth, then making sure that you're not overextending the joint can actually be really, really important. So all you have to do for that is to either gently block your chin and don't allow it to open all the way, or what I find to be a little bit easier is actually to put your tongue on the roof of your mouth and yawn that way. It's very awkward, but if you have that history of locked jaw, you need to protect it. Do not fully open and engage your jaw without being prepared for it. Tip number 8 is to stretch and move the neck. Weakness or tension in the neck is absolutely going to translate into tension in the jaws. So the easiest ones are things that you can do even just sitting at your desk at work. First, just up and down, raising your chin to the roof, pulling on those neck muscles, sternocleidomastoid, tuck that chin, look at the ceiling. Side to side. Chin to one shoulder and chin to the other shoulder. Definitely helps to make sure that you're holding the stretch for a couple of seconds, as well as ear to shoulder. Again, you're going to feel that stretch right along that trapezoid, right through there. If you're not feeling that stretch, it does help to just gently rest your hand on temporalis and just apply a little bit of pressure, a little bit of weight, and you should feel that stretch right through the trap. People with neck tension also tend to get a lot of tension in the occipital muscles, right at the base of the skull here. You can do a little bit of massage for those as well. Again, just looking for those sore trigger points, little circles, gentle pressure. The best way that I find to stretch those is to turn my head a little bit to the side, hand resting gently on the back of my head, and then just pulling forward gently. Holding for a count of 3, and gently letting go. Same on the other side. Looking a little bit to the side, hand on the back of the head, and just gently finding that tight spot. I like to settle my shoulder back as well, make sure it's seated fully, and I can feel that stretch all the way down my back. Tip number 9 is something that I'm always encouraging my patients with TMJ problems to do, and that's to try and decrease their overall stress. I know it's easier said than done, and I'm struggling with this as well. But the best techniques that I can give you are to consider deep breathing. Meditations are also really helpful. There's millions of YouTube videos with guided meditations. If it's not really your cup of tea, try a different kind. I like to do walking meditations, maybe not in the cold Canadian winter, but getting outside and connecting with nature I find is my favorite way to meditate. And the other way is, of course, to bring mindfulness into your everyday life. And being mindful, again, is going to help you recognize when you're clenching those jaws and how to, break the habit. And that's that's it for this video. Thank you so much for watching. I really appreciate it. Please let me know your thoughts in the comments below, and don't forget to please like and subscribe to my channel so that you can see more fun and informative dental videos. And don't forget to go floss yourself.